Good evening, everyone, and welcome to Harley Street Fertility Clinic's webinar on COVID-19 and fertility and pregnancy. My name is Lieve Verstraete. I'm the general manager of the clinic, and I have the pleasure of introducing you to our esteemed panel for this evening. So we'll hear from Dr. Geetha Venkat, who's our director, Dr. Lieve Verstraete, who's a very experienced consultant gynaecologist and fertility specialist, and Miss Rachael, who's our lead nurse. Our agenda to cover this evening is the 2019 novel coronavirus, a bit of background information on the virus and how it's passed on, the impact that this virus may have on fertility and pregnancy, and the vaccine or the vaccines that have been released for use against COVID-19. And then we look ahead to possibly having treatment while having the pandemic still ongoing and what you can do to sort of look after yourself. Without further ado, I will start with the introduction. We thought it'd be useful for everyone to get a bit of background about the pandemic. I know we've been living with it and it feels like such a long time ago now, when in March there was a lockdown of pretty much the entire country. But taking things back a bit further, in January, that's when the WHO, the World Health Organization, declared that the novel coronavirus outbreak that started in Wuhan in China was a public health emergency of international concern. This is their highest level of concern or alarm for any disease that's affecting the human population. And it was quite unprecedented for them to declare this. And to give you a scale of, the size of this illness and how it's affected the global population, there have been over 100 million cases, which, if you think about the world's population, it's somewhere around 8 billion people. So this is a significant percentage of all living people. And we've had over 2 million deaths reported globally. And these are only the reported figures. Now, of course, the real figures, particularly with deaths, are likely to be higher. And this was data as of the 11th of February that have been reported to the WHO. So what is this disease and, how does it sort of function? So it's a virus, and viruses are basically, they're not living organisms. They don't reproduce unless they're inside their host. So they're sort of dormant outside. They're not like bacteria. They don't sort of move around or anything. The virus is something that enters us via the respiratory system. It comes in as droplets through the oral or respiratory mucosal cells. It's if you can imagine a capsule, you see it on some of our backgrounds. There's the virus itself, its genetic code is in what's called RNA, and it's wrapped into a protein capsule. This is the sort of packaging around it, and that's how it gets into us. So it's got three what are called proteins, and proteins are the small molecules in us that actually do all the work in our body. So actually most of our sort of how we contract our muscles and how we think, and all those are controlled by proteins. And for the virus, there's only three of them. There's what's called a spike protein, which is the piece that you see sticking out. So for the virus, that's the piece that you see sticking out. That's what binds to your cells, and you can see that here. It's docked on to a cell. And then it's got an envelope protein, which is sort of like the box that you find all your parcels wrapped in. And then it's got a membrane protein as well, which is sort of the inner layer of bubble wrap that's meant to preserve and look after the RNA, which is the genetic code. So this virus, it attaches onto, let's say, a lung epithelial cell, and it binds to a particular receptor. And what happens is it then releases its cargo, its payload, into that cell. And it then hijacks your cell's machinery to replicate itself. That's why viruses are sort of like parasites. They leech onto our cells, they go inside, they replicate using our body's machinery, they make more copies of themselves, and then they once they've made so many copies, they actually get that cell to burst, and it opens up and it releases all of these new copies of virus. So you can see a sort of simplified depiction of the life cycle of the virus here. Now, I'm going to, at this point, hand over to Rachael, who's going to talk you through, how it's actually transmitted from person and how we look at detecting it. Thank you, Rachael. Yeah.
Thanks, Viv. So transmission. So as we know, the predominant way of transmission is through droplet. For instance, if you or someone around you coughs, sneezes, laughs particularly enthusiastically, small droplets that you often can't see are expelled from your mouth, from your nose. So those droplets can land anywhere. They can land on a person, can land on a surface. So for instance, if I laughed, that droplet then flies, lands on a desk. A colleague walks through, picks up a pen from that desk, and then goes to itch their nose, and that's how transmission happens. We don't often see it, but it's why we've all been told to wear masks of late. So as far as testing goes, at the moment we have 3 main types of testing. Tests, diagnosis, and symptoms. Testing and symptoms go hand in hand. So as the virus develops, we've seen symptoms change. Initially, the main ones that we were keeping an eye out for were a loss of taste and smell, fever, short of breath, and a temperature. As we've seen the virus go on, we've seen there's a lot more symptoms that come about: aches, pains. Often people have mentioned things, COVID toes, which say your toes go a little bit blue, chest pain, diarrhea, vomiting. So although we have symptoms, we must also test. The 3 main ways that we're testing are through a PCR test, a rapid test or a lateral flow, which is more readily accessible now, and the antibodies test. So the antibodies test will show you if you have had the disease, if you've been exposed and your body has made antibodies to that. Unfortunately, it won't tell you whether you have it right now. It will just tell you, have you had it before? The rapid test or the lateral flow is an antigen test. It's taken the same way as the PCR. So it's a nose and throat swab. If any of you have been lucky enough to have the nose and throat swab, you probably know it's a bit uncomfortable. It does have to go quite a way back to get an accurate swab. And it searches for the presence of an antigen, and you get a result much like a pregnancy test. Instantly, you can see it and it'll say positive and negative. And then we have the PCR test, which we at Harley Street use because we feel it's the most reliable. In a PCR test, I will do my best to explain, but what it does is it takes a swab and then it converts the RNA to DNA, makes millions and millions of copies so that those in the lab can then assess for the presence of that virus. We at Harley Street use the PCR test. Thanks, Viv.
I'm going to hand over to Dr. Verstraete to talk about the impact of COVID on fertility and pregnancy. Thanks, Rachael.
I'm going to explain a little bit talk a little bit on the impact of the virus on fertility and pregnancy. I'm afraid it will be a little bit disappointing because there is not lots of data available on the effect of COVID-19 on fertility, and our present experience is very limited. But what we know is that until now, there are no reports of the COVID virus found in follicular fluid or in oocytes, which is really good news, because it means that probably eggs cannot be infected by the COVID virus. On the other hand, for semen, we have rather mixed results. We have the impressions from the latest studies that men affected by COVID virus, that the sperm concentration can decrease. The problem is that we don't know exactly, is this a consequence of the virus infection? Is this a consequence of the medication which has been taken because of the infection? Or is it just an effect of the fever? Because we know fever can affect sperm production. So for the moment, we don't have much information on that, and we do have to wait for long-term results. Then concerning pregnancy, same thing again, no long-term data on pregnancy. In the beginning, the data were more reassuring. No, the latest data suggests that pregnant women infected with the virus have an increased risk of admission to ICU, invasive ventilation, and even death. Even if the absolute number of deaths is really low, it's increased in comparison with non-pregnant women. We do know as well that maternal COVID-19 infection is associated with a greater risk of preterm birth. This because of fetal reasons and because of maternal reasons, because of the disease. Ladies need to have cesarean section and will deliver before their actual term, and also there are more cesarean births. Also the same thing because of maternal reasons and fetal reasons. Then the transmission of the virus during the pregnancy, this is the vertical transmission, which means the transmission of the virus from the mother to the baby during pregnancy and during delivery. It's really uncommon. And if it happens, most the symptoms of the newborn are really, really mild. If it does occur, it appears not to be affected by the mode of birth, which means not if it's a cesarean or vaginal delivery, it doesn't make a difference. The method of feeding, if it's bottle feeding or breastfeeding, or whether the baby and the mother and the baby stay together, it doesn't make any difference. Risk factors for hospital admissions. These are risk factors as well for people to get infected, as well as for hospital admission. So we know that Black, Asian, and people from a minority ethnic background are more at risk to be admitted to hospital. The reason why we don't know, is it a genetic factor? Is it socioeconomic? Is it a difference in response to infection? We don't know yet. So again, there are lots of studies going on at the moment. At the moment, we don't have any answers. Then overweight and obesitas are also factors that is known already. Then women who had diseases before their pregnancies, as diabetes and chronic hypertension, are more at risk to be hospitalized. Maternal age is an important factor, 35 years or older, and living in areas or households of increased socioeconomic deprivation are more at risk of being admitted to hospital. Then workplace exposure, it's of course when people working together, close together at their work, they're more at risk of spreading the virus to each other. Then effect on the fetus. What we know, and that's a good thing, there is no significant increase in congenital abnormalities. We have now a whole register of fetuses born since the disease started, and we don't have the impression that there are more congenital, so no abnormalities, genetic abnormalities. There is also no evidence of fetal growth restriction, which means that the babies are smaller for their age as we expected as a consequence of the COVID-19. So overall, those outcomes are really positive. So what can we do? Play it safe. It means try to avoid treatment if you have COVID-19. So wait until a few weeks until the disease has passed by, and minimize your risk of contracting COVID-19 if you try to conceive or if you're pregnant, and this by the measures who are already set everywhere, like the physical distancing, washing your hands regularly, and wearing a mask.
Thank you, Lieve. Now, ladies and gentlemen, good evening. We have come to the important part of the presentation and webinar. I hope you will all wake up and listen, because everybody is interested in the vaccine, whether it is safe to have it or not safe to have it, especially fertility treatment and pregnancy. These are the important questions we are going to answer. If you have any questions or doubts, please feel free to ask us. So to start talking about vaccines, all of you are aware there are 3 types of vaccines, like Pfizer, BioNTech, Oxford, AstraZeneca, and Moderna. And these are all non-live vaccines, okay, just like killed vaccines. They are not with live viruses, because that is the difference between live vaccines and non-live. They cannot cause infection and they cannot multiply inside the body. Because of the infection, nobody can get the disease. That's what I'm trying to tell you. And again, people always, I've seen a lot of people discussing it. Oh, which one is better? Oh, so-and-so said I should go for Pfizer. So-and-so said it's Oxford is better. Or look, you cannot have a choice. The government is giving you free vaccination. We have to have the vaccination. That is the most important thing. There is not much of a difference between the 3 vaccinations. Everything stimulates the antibody productions and T cells in your body, which will give you immunity to the disease. That is the important thing. And whichever one you get, please have the vaccine. There is not much of, or there is no significant difference among the 3 vaccines. I'm happy to say that to you. What do we know about the vaccine? The simple answer is we know practically nothing about the side effects and the risks involved. Why is that? Because the disease itself is new. This started, as the name suggests, in 2019, and then end of 2019. And the real thing, it became a pandemic in 2020. That is early 2020, it became a pandemic. And after that, the vaccine has been developed towards the end of last year, and we are using it now. So there is actually no long-term data about this vaccine and risks of the vaccine, harm which it can cause. Particularly, we are talking about pregnancy, risk of this vaccine during pregnancy. Do we know much about it? No, this is a little bit of an extension of the past experience with other vaccines. First of all, we say that, look, we don't have any safety data regarding this vaccine during pregnancy. That is the fact. We have to accept it. And this is similar to any other non-live vaccine, I told you. That is basically killed vaccine. There is only contains the antigen or protein pieces inside. Therefore, it cannot cause infection. So whatever non-live vaccines people have had in the past during pregnancy, these did not cause any harm to the mother or the fetus. So these were safe vaccines during pregnancy. So if you apply this principle to this vaccine, which is also a non-live vaccine, we can say that it should not really cause any harm. But can I say it with confidence? No, I will say it with hesitation, because we are applying that principle to this vaccine. But you know, the disease itself is so different. Vaccine, we think it may be different, we do not know. That is why I say, we know we have limited data about this vaccine, and we will be able to say this is a non-live vaccine, therefore there should not be any harm during pregnancy. Now, who should be vaccinated? Then, as we know, these are high-risk people who need to be vaccinated first. We can call them priority groups. These groups have low immunity, therefore they are at risk of catching the disease quickly. And also, if they get infected, the disease can become severe and they can suffer a lot. They can have multi-organ complications, and in addition, it can lead to death. That is why we say these people are at risk of catching and getting severe disease and leading to death. And that group includes people who had transplants. These are transplant recipients. As you know, to keep the transplant viable in the body, we give them immunity-lowering medications throughout their life, and this can reduce their immunity and make them vulnerable to catching this disease. And those people who have severe respiratory conditions, you might have heard of cystic fibrosis, where the genes, there are 2 genes responsible for this, causing this condition, one from the mother, one from the father. And if the person has got 2 genes, then he has the disease. These people have lung problem because they secrete a lot of mucus and it blocks their lungs. The lungs are not very well functioning. And in such cases, they are easy prey for this disease, and they also have severe form of the disease. And similarly, people with severe asthma, where it is not well controlled. And these people who have had frequent or many medical hospital admissions, and such people again can have a serious form of the COVID-19 disease. And those with homozygous sickle cell disease, again, they are prone to infection, and those receiving immunosuppression therapies, people on dialysis or with chronic disease, with kidney diseases, and those people with congenital or acquired heart diseases. Such people are clinically vulnerable people. And these are based on health reasons. But there is another group. They become vulnerable because of their profession. They are the frontline health and social care workers. Those people are working in the hospitals, like doctors and nurses and other paramedics, and those people dealing with the COVID-19 patients. They can catch the infection from the patients. And similarly, social care workers in the care homes, those old people can get it, and from the patients, these healthcare workers, and catch the infection. Hence, these people are all at high risk of catching the infection, and they should have the priority to get vaccinated first. I'm sure all of you have read this in the papers and listened to it in the television, watched it in television and listened to it in radio. The government has formed different groups according to their vulnerability score and given priority, and they are distributing the vaccination accordingly. Then, so we talked about all the vulnerable group. Now, with regard to fertility, and what are you going to do? Or if you are trying for a baby and you want to think about vaccination, do you delay starting your family? Or do you delay your vaccination? What do you do? This is a big question. And especially if you have a time factor on your issue. Say, for example, if a woman is over 40 years, she doesn't have much time. Every month becomes so important under these circumstances. Therefore, if she's going to go for IVF, and if she has to delay the treatment, it becomes worrying. And that is why we say, look, nowadays we will tell you what is the regulation and what we advise. With regard to fertility, have the COVID-19 vaccination, and you can start the treatment as soon as possible. That is in the next cycle. Therefore, you are not delaying it very long. And it is safer for someone to have the vaccination and start. Otherwise, you start the treatment, you get pregnant, and then you have concern about having the vaccination again during pregnancy. So why cause more problems for yourself? It's better to get it out of the way, do the vaccination, and then follow in order. That will be more helpful. Right. Now, if I said that this is about the treatment, when to start the treatment. And one thing I just had to mention there was previously, there is, in December, all the professional bodies were sort of very hesitant, and they were not sure as to what to advise. In January, their advice, that is professional bodies like British Fertility Society in UK and American Fertility Society in US and European Fertility Society in Europe, they were all saying in January, look, if someone has got the vaccine, had the vaccination, they should not start the treatment immediately. That is, any fertility treatment like IVF immediately. They should wait at least for 2 months, and then only we start the treatment. That was their advice, because they thought that due to the reaction and also the viral particle, nobody knows the effect of all these things and the hormone stimulation and the development of the follicles and the eggs. So the best advice was to delay the treatment. And we prepared the advice to our patients and put it in our website. By the time we drafted everything and put it in the website, it became end of January and beginning of February. And then we get a big U-turn on this from the professional bodies. Now they are saying that it is more important to vaccinate everybody, and there is no risk if you have vaccination and start your treatment a few days after. All the professional bodies are now recommending that if you have vaccination, you don't need to delay the fertility treatment. And this is one of the common questions our patients ask us. Look, I'm going to start IVF. How long should I wait after the vaccination? So now the advice is you wait at least for 7 days, so that in case you have some allergic reaction to vaccine or some issues with that, then you are not starting the treatment at that critical stage. That's why they ask us to avoid starting the treatment within 7 days of having the vaccination. And as a policy in our clinic, this is the Harley Street Fertility Clinic, what we suggest to patients is, okay, if you have vaccination, don't start the cycle in that month, that is, in that menstrual cycle. We start the stimulation in the following cycle. That way, it is like a month, 3 to 4 weeks of delaying the treatment, and we waited for all the reactions and everything to settle down, and it is safer to start. That's what we do in our clinic. And again, vaccination during pregnancy. That is another thing. Here, it's not very simple. People are so scared because it is because of lack of information and also ignorance. Mother always wants to protect the baby very much. So they always say, oh, I don't want my baby to be affected by this vaccination. Should I do it or not? What should I do? So they say that if you are very careful, if your risk is low, like you are not in the highly vulnerable group and you are not a frontline health worker or care home worker, then you can think about whether to have the vaccination or not. But if you are in the priority group, like I mentioned, or a vulnerable group or a high risk group, then it is important for that individual to have the vaccination, because here the benefit of the vaccination is more than the harm. That is, if you catch the disease, it's going to be severe and you are going to suffer. It can also lead to death. That is the reason in the vulnerable group say we must do it. Even if someone is pregnant, don't hesitate, please have the vaccination. But at the same time, if someone is not in the high risk group, then the question comes, what should we do? Should I have the vaccination or not? To be or not to be is the question here. And nobody has a clear answer, but we will say that all the societies are saying, so far, like I mentioned, it is the basic principle. This is a non-live vaccination, and such vaccinations in the past have not resulted in any harm to the fetus or baby. Therefore, it is okay to have this vaccination. However, we do not have any long-term safety data regarding the effect of the vaccination during pregnancy, either on the mother or on the baby. We should know that. So each person, individual who is in that situation, should think about her own risk. Am I going to catch it easily? Say if you are going to be very careful and stay at home most of the time, then you are reducing your risk. If you are able to do that, if you are able to adjust your life, then you can wait till you deliver and have the vaccination later. But if you are not sure, then if you want to go around and if your risk is higher, then it is better to have the vaccination even during your pregnancy. That is what now the professional bodies recommend. Then the question next comes is, when is the best time to do the vaccination in pregnancy? Should I do it as soon as I get pregnant in the first trimester, or in the second trimester, or before I deliver the baby? Which is the best one? Again, there is no clear-cut answer because a lot of patients ask me, and a lot of my family members, like my nieces and others who are all trying for a baby, and somebody is pregnant, they're all ringing me and asking me, what should I do? What should I do? Should I have it or not have it? Then I always say, this is a general common sense advice. It's my personal view. It's not any professional body's advice. I have already mentioned to you about their general advice. That is all good. You can have the vaccination during pregnancy. But I say that it is better to avoid any vaccination in the first trimester. That is because this is the time when the organs are being formed in the fetus. That is the period of organogenesis, we say. And this time, any virus, I know Suvir mentioned that it is not actually a virus, it is protein or antigen which is introduced. But later on, there may be some reports saying that, this one caused this congenital abnormality or some problem in the fetus. We don't want to be in that statistics. Therefore, we say it's better to avoid in the first trimester. I don't want to take any chance for my baby. That's what the women say. I think that's what we should think about. And also, we don't know, sometimes it can cause higher risk of miscarriage. To avoid all these problems, better not to have the vaccination in the first trimester. And for anything like flying, everybody asked me, when can I fly during pregnancy? Avoid first trimester. And then after some 30 weeks, they will not allow you to board the flights because you can deliver prematurely and they will be in trouble. So then the best time to fly is the second trimester. Similarly, best time to have the vaccination is the second trimester. This is a trimester which goes smoothly, and this is the best time to have the vaccination so that you don't have these side effects on the baby's organ development. And during the third trimester, there could be complications sometimes with preterm development and other preterm delivery and other things. Therefore, if you want to, that is from the disease I am mentioning here. If you want to avoid those complications from the COVID-19 disease, so it's better to have the vaccination in the second trimester to prevent complications in third trimester, because now there are some papers which say that there are more complications in the third trimester. Even my colleague, Dr. Verstraete, mentioned that you could have preterm labor and higher need for cesarean section due to other complication, high temperature and respiratory problems can lead to complications. So to avoid the complications of the disease in the third trimester, which is most severe in the third trimester, we say, do it, prepare your body by vaccinating so that you prevent the onset of the disease. That's why I think avoid the first and last trimester, do it in the middle, which is reasonably safe. But the question of whether to do it or not is up to the individual woman. If your risk is high, risk of catching the disease, suffering from the disease is high, have the vaccination. If your risk is minimal, you are able to protect yourself, you can postpone having the vaccination. And as you know, when I say you are able to take precautions, it's like social distancing, wearing masks, and we should have this OCD of washing the hands again and again, And all these OCD people keep washing the hands 10 times a day. Now we have to wash the hands 20 times a day. So that is to be very careful. Regarding the fertility treatment, how do we reduce the risk? And when we undertake the treatment, we have to be careful, being aware of the risk and minimizing them. That is what all the professional bodies tell us. Basically, that is the job of the doctors and all the patients, because we say, do no harm. Don't do something which can harm the patient. I don't want to ask you to have vaccination, which can lead to problems in your case. So similarly, it's my duty to reduce the risk of somebody catching COVID-19. And in our clinic, we do this what are called immune treatments along with fertility treatment, because we get a lot of patients who have had multiple unsuccessful IVF treatments in other clinics. Even just my last patient before I was doing a consultation, in fact, Suvir was phoning me, why you are joining the webinar? Because I was just finishing off the consultation. And that lady had 6 IVF and ICSI treatment. None of them have been successful. And that means we have to do something different. One of the things which we do is this immune testing, like autoantibodies, thrombophilia screening, and these natural killer cells and other things. I don't want to go into those details. And we follow these immune treatments to suppress these immune issues, which will increase the chance of somebody getting pregnant during fertility treatment. If someone is having that, we tell them very strictly that they have a high risk of catching COVID-19. Therefore, they should be extra careful. They should stay at home. They should not go out, mix with others. And even her partner or who is staying with her should be careful, because one of our patients who is a famous celebrity recently, she had this treatment. In fact, she sent her partner to his house, separate, means his parents' house or some house. And she stayed alone during the treatment because he cannot stop going to the job, which involves meeting other people. And she did it to protect herself. That's why it's important. We must minimize the risk of catching COVID-19 when you are having immunosuppressive treatment along with fertility treatment. And that is one of the things people should keep in mind. And of course, adjust your lifestyle accordingly. You can't have this normal social life of parties, birthday parties, Christmas parties, and going to the pub, enjoying, having a good life. Now the COVID-19 has changed everybody's life completely. So we have to live like that. And if you're at high risk, please consider getting vaccinated and having the fertility treatment afterwards, especially if I think for people who are going for immune treatments, it might be a good idea for them to have the vaccination and start the fertility treatment in the next month with the immunosuppressive therapies. Now, what are the next steps? How do we proceed if you are trying for a baby, if you don't know where to start? This is the basic guideline. First of all, you must do what is called fertility checkup. What is it? It's like a fertility index. Where do you stand as far as fertility is concerned? Like in other things, we know, how good your IQ is. There is the test and other things. Similarly, you want to know how good your fertility is. Then we do fertility checkup for the male, which is semen analysis, simple. Whereas for the women, it is scan and blood test to check how many eggs she has got by blood test as well as scan. That will give us the ovarian reserve and other details. And that will tell you what are your chances, whether you can try naturally or should you go for treatment. So those things, first you know what you are going to do. You have a plan as to how to proceed. Then next step is to consider vaccination. If you are nowadays, the vaccine is available. Last year, we didn't have vaccine, so there was a lot of issues. But now we have the vaccine available. Therefore, the safest thing is to have the vaccination first, then start trying from next month. Or if you are going for fertility treatment, start the treatment in the following month. And at the same time, we must remember vaccination does not give 100% protection. And also antibody stimulation in people will be different. Each person has got a different capacity of producing the antibody. Unless we measure and say you have got enough antibodies, we don't know. Therefore, don't think that, okay, I had the vaccination, I don't need the mask anymore, and you don't have to start having parties and changing the lifestyle. And we must be cautious still, take all the precautions. And as we have mentioned here on the screen, if you want to read or get more details about these topics, as I mentioned, all these countries, the different countries, societies are there, professional bodies like British Fertility Societies, European and American one is there, Royal College of Obstetrician, and our regulator, please, we should not forget that, Human Fertilization and Embryology Authority. They also have details on their website. You can refer to them. And Subir, I will hand over to you now.
Thank you very much, Dr. Venkat. So I would like at this point to play a short video that we have put together. It's from a patient's point of view of having treatment during the pandemic.
Our family.
My son searched on the internet.
So you have another boy and a son?
Yes, I have one boy, 16 plus. He's going to 6th form. He's doing A-level. First, I spoke to Karina and I made an appointment, first appointment with Madam Karina. And after I meet, I went to clinic, I meet Joanna. Joanna is so nice, very helpful lady and great person, great lady.
And then Darshi and Dr. Venkat?
He is so nice and so helpful and so great person. Do you know Dr. Darshi?
Yes, I know Darshi, yes. I know everyone.
She's so nice person.
You know Darshi because you spoke with her and she helped you.
She did help me.
Okay, so what help you needed? What is your treatment?
Is IVF treatment.
Using your own eggs?
No, donation. Because I have problem. That's why I haven't got own egg.
And then you met with Darshi and she told you about...
Yes, Darshi spoke to me always time. She is so nice and she arranged for me everything.
The fact that it was pandemic didn't stop you to go with the treatment?
Didn't stop me.
Because you wanted the baby.
That's why, yes.
When did you start your treatment with us?
It started is 10th of September 2020, first appointment with Dr. Venkat.
So now you're pregnant, yes?
Yes, I have 11 weeks gone. Today is 11 weeks, 1 day.
Congratulations. It's a wonderful journey. It's just the beginning of a
Yes, thank you very much. I am so lucky.
What made you choose Harley Street Fertility Clinic? What made you choose us?
Because I know Harley Street Fertility Clinic is best of the world.
I agree with you.
Yes, I know. My husband told me is another fertility clinic. I told him, no, I want to have a Harley Street Fertility Clinic. I am grateful and successful. Now I am successful. I am so happy with this clinic. Meet so many nurses. Everyone is good, very nice, very helpful, very friendly.
Thank you. That's so nice to hear. What about the people at the reception?
Joanna, Karina, is Steve, I think, one man.
Stephen.
Which name is Steve?
Stephen.
Oh yes, very nice person. I went to clinic so many times. I can't remember that. Weekly 2 days, weekly 3 days, 1 day, so many days I went to clinic and everyone is very helpful and very nice.
So what message would you like to tell Dr. Venkat?
Dr. Venkat, you can tell her is I am so happy with her. She's successful with me.
Our family.
Okay, I'd like to thank Delia for putting together that short film with a lovely, heartwarming story from a patient. But then to wrap up, we will take some questions from the audience. We've had some submitted, so I will field these to our esteemed panel. I'm just going to unmute everyone. The first question that we have had is, and I think we've answered this already, but just to sort of clear up everything. If you've had COVID, does it affect your chances of future pregnancy? So I'd like to pass this on to Dr. Verstraete, if that's all right.
So the question was, if you had COVID, if it will affect your chances of getting pregnant?
Correct.
No, I don't think so. So if you had the COVID, then you had probably antibodies against the disease. So you don't have the COVID while you're pregnant. So there is no problem. Yeah, so
okay,
for the lady.
Thank you. And the next question that we've had is, does taking the vaccine affect your chances of future pregnancy? And I'd like to pass this one to Dr. Venkat. That's all right.
Yes, that is the question. We were saying whether the vaccination or vaccine has got any effect on sperm or any effect on egg or the number of eggs and any effect on getting pregnant or conceiving. And we don't have any data, but people have done some research. it does not have any effect on eggs so far. That's what people have shown. And like Dr. Verstraete mentioned, we know that the COVID virus, if somebody has had infection, that can be present in the semen. And it can have some effect on the seminal samples or sperm count and other things. Whereas this vaccine is not a virus, as you know, as I told you, it is a protein or antigen, and it cannot cause any harm on the sperm, egg, or your chances of getting pregnant and problem with the pregnancy.
Thank you. The next question is, if you've had COVID and then become pregnant, would the child be affected? Dr. Verstraete, if I might send this one to you.
No, this question resembles a little bit the first question. So if you had COVID, so then you don't have the disease while you're pregnant, so you have formed antibodies, so then there's no problem.
Thank you. And sorry, I didn't mention this. All of you, if you'd like to submit a question, please do so using the Q&A feature in the Zoom window. The next question we have is, I'm hoping to start cycle number 4 in May or June. If I get offered my vaccine before then, should I go for the vaccine? Dr. Venkat, if you wouldn't mind answering this one, please.
Yes, I think now everybody is interested in having the vaccine to protect themselves, number one. Number two, we also have to reduce the pandemic. We have to have a closure for this. Otherwise, it's going on for years. We are all fed up. And so we want to stop the spread of the virus. I think more people get vaccinated, it's better. And if you are not starting fertility treatment immediately, this is the time for you. Please go and have your vaccine and the second dose, and then you will be able to start the treatment after that.
The next question is Harley Street Fertility Clinic still offering intralipids and or steroids to those who need them during the pandemic?
Yes, and that is a very good question, because there were a lot of issues during the pandemic. In fact, as you may be aware, the fertility clinics were closed for 2 months when the pandemic started. When we had the first lockdown, we got an email from our regulator, Human Fertilization and Embryology Authority, saying that we should not start any new IVF treatments. We should complete those for whom we have started, and we must close the clinics till we ask you to restart again. So the clinics were closed for 2 months at that time, and we were not offering treatment. And then the regulator wrote to us saying we can reopen and start the treatments. And again, there were some questions about whether to give these immune treatments or not. And we wrote to our regulator and we got the answer saying that, look, the regulator generally does not support the immune treatments. That is their basic bottom line. And in the pandemic, because of the increased risk, they don't support it. But we wrote to them and we said that, look, there are so many patients who have had 4 or 5 cycles, and this is the important one for them. Otherwise, their treatment will be wasted. And how long can they be waiting? Because we don't know. We don't seem to see the end of the pandemic yet. And therefore, after huge discussions with them, they asked us to do a risk assessment and have a protocol so that we are not putting these patients at high risk of catching the COVID-19. Therefore, before we start, we do offer intralipids and prednisolone and all the other immune treatments which may be needed for depending on their condition and the antibody situation. We do offer them now, but we have a protocol. We first screen them for COVID-19 first to make sure they don't have disease at the starting of the treatment. And during the treatment, we tell them they should stay at home. They should not move around. They should isolate. Like I mentioned during the presentation, some of them, they don't go anywhere. They work from home or stay at home to reduce the risk of catching the disease. And if any of them develop symptoms of COVID-19 during their treatment with immune immunosuppressive treatments, we tell them, look, we will stop it at that time. And with all these precautions, we are still doing it. At the same time, we are taking all the precautions to prevent any problems with the patients. And our regulator is sort of okay with that. And lots of clinics are doing, and we also do it because, like I said, we get lots of patients who have had unsuccessful attempts before. And for them, they need a different kind of treatment, like some variation in the stimulation and other thing. And most of them need this immune treatment as well. And I'm happy to say we offer and we change their lives by making them a baby.
Next question we have is, what happens if I have the first vaccine, then I'm pregnant and I can't have the second vaccine? Dr. Venkat, if I can ask you to answer this, please.
Yes. Again, this is a tricky question. I think they are trying this knowledge or answer. But I'll say, look, the same thing, same principle applies in life. If you think your risk is low, if you don't want to have the vaccination during pregnancy, then go. You miss the second dose, don't have to have it. But otherwise, if you think that it is better to have the vaccine to protect yourself from the disease, as I mentioned, particularly the complications are more in the third trimester, the best time to do it is in the second trimester and not in the first trimester. But if the decision is going to be yours, I cannot make the decision for you. I can only give you my advice, my viewpoint, and the professional body's guidelines. So at the end, I leave it up to you.
The next question we have is, would you still conduct or require a COVID-19 test when someone has had both doses of the vaccine?
The answer is yes.
I think we will all be in agreement. We haven't seen such a person yet because not many people have had 2 doses of the vaccine. But see, the thing is, the vaccine doesn't guarantee you immunity. They only have a certain percentage effectiveness. So I think currently the effectiveness is about 90%. So if 100 people have the vaccine, 90 of them will get immunity from the vaccine. The remaining 10 won't be immune. So if you've had 2 doses, one, we might check whether you are immune. And we still don't know whether you can catch the illness, even if you've been vaccinated. Vaccination only protects you from the actual sort of full-blown symptoms and disease progression, not just catching it. So, and you could still spread it to other people. We just don't have that information as of yet. So to play it safe, we will continue to test people, I think, as long as this pandemic plays out. Next question is, if you've already had COVID, the disease, is it still advisable to have the vaccine whilst trying to conceive? Dr. Venkat, if you wouldn't mind answering this query.
Yes, because now we have had some of our staff nurses, Rachael knows this very well, she will agree with me. Our colleagues, 2 of them who were working closely with her, had COVID-19. And when they came back after that, the whole clinic, we went and had our vaccination because we are frontline workers. And we advised them they were bit, I don't know whether they were nervous or anxious. They were not sure whether they needed the vaccine or not. And particularly now, in your case, you are going for fertility treatment or getting pregnant. You do not know whether to do the vaccination or not. But I think it is safer to do the vaccination because they are saying after the disease with COVID-19, some people's antibodies are disappearing after 3 months. What is the level of antibody you have had? We do not know. And we can also have the new variants coming up recently. So there are so many things which we do not know. I don't think we should sort of stay quietly thinking, oh, I had the disease, so I don't need vaccination. Don't be laid back in this matter. You must get as much protection as possible. So please have the vaccination and then start your treatment or trying to conceive after a month.
The next question is asking what is the maximum BMI for IVF and up to what age? I appreciate this is not a COVID-related question, but we'll take it, which is our standard BMI. We treat patients up to a BMI of 35. Beyond that, we do a bit more of an extensive review because, again, it's a question of risk. Can we treat you safely? And will your pregnancy be safe? And so we don't have a firm cutoff for BMI. And similarly with age, we don't have a hard cutoff. We will gladly let patients up to the age of, for the female, up to the age of 45 try with their own eggs. Beyond that, we'll have a longer conversation with you about the risks or the benefits of trying treatment. And if you're considering donor eggs, our sort of soft cutoff is 51, your 51st birthday. Again, beyond that, we will do a risk assessment of you and you safely carrying the pregnancy. And most importantly, can we look after the welfare of the child that might be born from this treatment? That's the most important consideration. So we review it very closely on a case-by-case basis before making a decision. Next question is, if you're in the middle of IVF treatment, for instance, your embryo transfer cycle, when would it be advisable to take the vaccine? Dr. Venkat, if I could ask you to answer that one, please.
Well, that is a difficult thing to answer because I, in fact, mentioned that we should do all the vaccination before starting the treatment. I wouldn't do any vaccination in the middle of a treatment because supposing you have some allergic reaction and you are having all these hormones and then say we fix your embryo transfer, is it the right thing to do, to transfer the embryos when you have some severe allergic reaction to the vaccine? I'm not saying everyone will have that. However, there is a possibility that you can have allergic reaction. And I don't think it's a good idea to do it in the middle of a frozen embryo cycle, if that's what you mean. And even during a stimulation, even if you're not going to have embryo transfer in that cycle, you are going to freeze all the embryos. If you're going through stimulation, I don't think that would be a preferable time for the vaccination. If you are going to have a stimulation and freeze the embryos, after freezing the embryos, you can have vaccination. Or before starting the stimulation, you can have vaccination. And similarly, before starting the frozen cycle, we can do the vaccine. We can advise women to have vaccination, but I'm not keen on women having this vaccination in the middle of the fertility treatment, even the frozen embryo or fresh cycle. I think I have answered your question. Would Lieve, would you like to add anything, or Rachael, would you like to add anything to what I said?
Oh, I think that you perfectly answered the question.
I agree.
Great, thank you.
Thank you all. I'm glad we're in consensus. Now, this is more of a practical question. After the pandemic, when we're reopened, we are playing things very carefully. We're managing the number of people on site. And one of the difficulties is when you go through treatment, you might be on your own for procedures that you might not have before the pandemic. It's really in your own interest. So the question that's come through, which I'm sure our nurses face day in, day out, so I'll let Rachael answer this one. Are partners allowed in for scans and or embryo transfers?
It's such a hard one because I know patients really would like their partners there and it's such an important time, but it is in the interest of everybody's safety that we minimize, as Severe said, the amount of people in the clinic. So short answer, no. Only patients for all scans and transfers, but at Harley Street we are happy to try in whatever way we can to make it a little easier. If you would like us to FaceTime your partner, Zoom your partner, we're more than happy to, but unfortunately it is just the patient in the scan room and in theatre.
I was just thinking we should get the partner on the big screen in theatre, Rachael.
Oh, we should actually. That's a great idea. Great idea.
And then we have just one more question at the moment. At Harley Street, are there any extra costs to pay on top of treatment to have COVID tests done? And how often during treatment do we need to have these tests done? So we are a private clinic, so I'm afraid all our services are chargeable. I think we charge about £100 for a PCR COVID test. And we require you to have it done once before you start your treatment. I think it's about a 3-day window. Is that correct, Rachel?
Yes, it is.
Yeah. But if you have it done on the NHS, or you can get it through your workplace or wherever it is, we're happy to accept those reports. It's not a problem. You don't have to have it done with us. Our PCR methodology is not any better than anyone else's. And that's all our questions. So thank you all very much for those questions. I think it was quite a useful discussion. If there are no more questions, it leaves it to me to wrap up this evening. So first of all, I'd like to thank all of you for attending. I hope that it was useful and informative. And then I would like to thank all of our panel. So thank you, Dr. Venkat, thank you, Dr. Verstraete, and thank you, Rachael. And last but not least, I'd like to thank Delia for her efforts in getting this published. And I'd like to thank her in advance for putting this recording together. It will be available on our website if you need to listen back to it later because you've forgotten what we said. And with that, I'd like to bid you all a very good evening and a lovely weekend. Thank you.